Good morning, everyone. My name is Robert Libbey. I'm a registered massage therapist, author, clinician, and researcher. Thank you so much for being here with me today. Thank you to the American Massage Therapy Association and the Massage Therapy Foundation for funding these research poster sessions at the National Convention here in Denver. This research is the Ligamentomuscular Reflexes, Implications for Musculoskeletal Rehabilitation, a review-based framework for musculoskeletal assessment, proprioception, joint stability, and rehabilitation planning. A clinical framework for organizing the ligamentomuscular reflexes of joint capsules, ligaments, and related articular tissues. This information is all documented in a textbook that I have written on ligament pain, your resource for axial and appendicular ligament and joint tissue referral patterns. You can scan this QR code to be taken to the web link where you can purchase the book. Most of us learned to think of ligaments as passive structures. They connect bone to bone, limit excessive movements, and stabilize joints. But ligaments are not passive restraints alone. They are sensory tissues. Ligaments and joint capsules contain nerve endings that send information about joint position, movement, mechanical stress, and potentially threatening input. In this review, I ask a simple clinical question. What sensory information from a ligament or joint capsule changes what can happen to muscular control? A ligamentomuscular reflex is a pathway where joint sensory information influences muscle activity through spinal and brain processing. Muscle activity may increase, decrease, or change within the situation. Joint position, pain, swelling, and muscular activity can matter. These tissues contribute to proprioception, our sense of where a joint is, and how it's moving, and stability during movement. After injury or surgery, altered sensation information may change muscular recruitment. I reviewed studies of ligaments and joint capsules, stimulation, and muscle responses, organizing evidence by ligament, muscle, nerve pathway, response, timing, and source. Knee studies of the ACL, PCL, MCL, and LCL showed activation, inhibition, and mixed responses. They are not simply on-off switches. Responses vary with task and study conditions. This pathway matters. Joint injury may alter sensory information going into the nervous system. Pain, swelling, reduced proprioception, apprehension, and compensation may influence the motor response coming back out. For clinicians, this raises an important question. Is a muscle weak because it is simply deconditioned, or could altered sensory input from the injured joint be contributing to inhibition or altered activation? Rehabilitation needs more than strength and range of motion. It may include proprioceptive retraining, balance, graded loading, movement confidence, and functional progression. For massage therapists, this suggests why guarding, weakness, or altered movement do not always reflect a muscle problem. It supports assessment, comfortable positioning, graded treatment, movement cueing, active rehabilitation, education, and referral. It does not mean we can diagnose or reset a reflex pathway. Consider a client after a knee ligament injury. The quadriceps appears weak, but the explanation may involve more than deconditioning. Pain, swelling, altered joint input, and nervous system responses may influence activation. Ligamentous injury may both be a tissue injury and a sensory motor injury. The evidence has limitations. Results vary by joint, study design, stimulation method, population, muscle recording methods, and response timing. Some use experimental stimulation rather than natural movement or loading. These reflexes should never be the sole explanation for pain, weakness, guarding, or dysfunction. They are biologically plausible and clinically relevant mechanisms requiring continued validation. The main takeaway is simple. Ligaments are not passive restraints. They are sensory tissues capable of influencing muscle activation, inhibition, proprioception, joint stability, and rehabilitation outcomes. When a ligament is injured, we should think beyond damaged collagen. We should also consider the sensory information coming from the joint, how the nervous system responds, and how this may influence movement and muscle control. The QR code provides you with a database, references, and supplementary tables. This information is all documented in a textbook that I have written on ligament pain, your resource for axial and appendicular ligament and joint tissue referral patterns. You can scan this QR code to be taken to the website where you can purchase your copy. Thank you again for being here with me today at the American Massage Therapy Association National Conference. Thank you also to the Massage Therapy Foundation for sponsoring these research posters. I greatly appreciate the time and effort that everyone has taken to peer review this information, and for you specifically for being here, being interested in this information, and being interested in research and incorporating this into your clinical practice. Thanks again.